welcome to this session on OET. Yeah. So, in this session we are actually going to look at what exactly is OET and who are the beneficiaries of OET, because there are a couple of English, international English language tests like the ones that you can see here. We have the IELTS, which is the most popular one, and even IELTS has some new additions to it, which is the life skills, which you can see, which is on the top most slide. And IELTS even has two versions, which is academic and general, which is different for students and professionals who intend to go as migrants and later work. Now, there are a lot of misconceptions as to the right course that one has to join. So normally people join these English courses just because their friends or somebody else or friend's friend has joined, or they see some ads in the newspapers or on electric posts. So choosing the right course or the wrong course can make or break your career. Now, who are the people who have to look for OET? Why OET and not IELTS? I'm not saying you shouldn't take IELTS. It depends on what, like the purpose of your visit, whether you're a student, whether you are a migrant, or you intend to work subsequently as a professional. Now, here what we are going to look at is OET alone. We'll also take a look at the IELTS and how it differs from IELTS. Now, the modules are the same, but the pattern is different. Now, OET, as we all know, stands for Occupational English Test, which actually assesses your skills in the all four modules for a job in the healthcare industry. Now, English is basically different in OET because here OET modules are tailor-made in such a way that they test your healthcare skills. If you're a nurse, your content would be exactly the content related to your occupation, which is the nursing. Now, as you can see here, OET is in fact international eligibility test for healthcare providers. That is, there are students and migrants and job seekers who are included in this profession, in this category, and we are actually looking at the category which are, these are the 12 categories which are covered under the OET. Now, on the top you find medicine, which is the doctors who have to take the same OET test. Now, the content for OET, the modules differ from profession to profession, mainly because the contents are different. Here in medicine you have mainly the documents related to surgery and medications, but here in nursing it's entirely different. You do not have to concentrate too much on administering medications and so on and so forth. And dentistry again will be related, the modules will be related to their specific theory and practice. So we are actually looking at nursing and not these 12 modules. I'm sorry, we are looking at nursing alone here, assuming that students are likely to be from this industry. Now, veterinary is also included, but there's a slight difference in the syllabus as regarding the speaking module. In nursing, you will be taking the role of a nurse, and whereas in veterinary science, you will be the owner of a pet. I will come to that a little later. Now, these are the countries that you can see here that requires and recognizes OET. You have the UK, United Kingdom, and Australia, New Zealand, and here you have Ireland, which has recently recognized it. So you also have Canada, which is recognized OET, and here you have Singapore. Singapore, apart from these countries, you have smaller countries like Malaysia, which recognizes OET. So we are mainly looking at these major countries where OET is recognized and required to for healthcare professionals to work in an English-speaking environment. Now, as we know that in India is not, even though people in India speak English, we are not an English-speaking country, not considered as an English-speaking country, because English is learned and taught as a second or third language. Now, as far as Ireland is concerned, I am told that there is a slight requirement has been laxed or reduced for Ireland. I think the required score for any of these countries is a B. B is equivalent to 7 in IELTS. Now, due to the shortage of nurses in these countries, Ireland has actually planned to reduce the grade from B to C, which means that more and more people are likely to move to Ireland. And also, Australia has around 120,000 requirement of nurses in that country. So, we are looking at migration happening from different places. Now, these are the bodies that recognize the OET. Now, the professional bodies like hospitals, nursing associations, veterinary associations, and immigration departments, universities and colleges, visa agencies, and the OET publishes the list of bodies that recognizes the OET in these courses. Now, if you look at universities and colleges offering courses which are related to healthcare, you find the colleges require you to take an OET if you are looking for higher studies in countries like Canada and UK, Ireland. If you are joining a course in nursing or healthcare courses related to healthcare industry, you have to have an OET because it is related to the healthcare industry, because tomorrow you need to get accustomed to the medical language, because IELTS is basically general English, and here in OET you have the medical English. Sorry. Now, even Singapore recognizes the nursing association, and Singapore recognizes these the OET. Now, the OET was actually started by the same people or the group of people who started the IELTS. So it has been there. NUSAR, as you know, is a Australian regulatory body which started the OET somewhere in around in the 80s, but it has not been popular in India because you have very few people who can teach OET. The reason is that you not only have to know English, but you need to know medical English. Now, if you are looking at the legal industry, lawyers, for instance, you have something known as the legal English. For businessmen, you have something known as the business English, which is totally different from general English. So that's the reason why they came up with a module which is related to the profession. So here in OET, you do not have to be a generalist. You do not have to know a lot about geography, computers, which is normally a part of the IELTS exam. Now let's look at the format here. Now this is the format. The listening is of 50 minutes and you have two tasks here. The part A is basically a conversation between the healthcare professional and a patient, and you will be asked to make notes based on the listening. And part B is actually a monologue, which is a lecture, and it can be a talk or a lecture or anything of that sort. Monologue, which means that only one person will be talking, but here in the part A you will have two persons speaking. So one person will be the patient and another person will be a nurse if you are taking the nurses module. So note taking is basically, you do not have to complete full sentences, you need to just complete the blanks. It can be similar to the speaking module, which we will cover a little later. Now in part B, it's somewhat similar to IELTS. You will need to have a summary completion, a table or a flow chart. Now I'm sure most of you have seen how a flow chart has to be done in IELTS. So this will have a medical twist to it. Now a flow chart could be like the number of patients who died of cardiac arrest in a particular area or during a particular span over period of 10 years or whatever. That could be a flow chart. Now, reading. Now, reading also has two. Now, in reading, you need to read a text, and you will need to actually complete. You look for terms like skimming. I mean, I'm sure this is also taught in IELTS. You're looking for key words that can fill the particular MCQ or whatever it is. Skimming is actually looking for particular word. For instance, when you wait for a bus in a bus station, you normally have a lot of buses going with names like Kalur, Alua, whatever. So if you are traveling to Kalur, you look only for that particular word Kalur. So these are key words that you're looking to complete your assignment here. So what you require here is skimming, which means that you look for particular words and sentences to complete your answers. So that is the way in which it is programmed. Now the writing is 45 minutes, and you will need to write 180 to 200 words here. And in IELTS, it's totally different here. Here you will need to write a referral letter based on the notes that are given to you. Now, a letter can be to a parent or to a healthcare provider or a social support worker or any other authority which is in the healthcare industry. Now, as far as nurses are concerned, you will be writing a letter to the social support or another nursing facility to transfer the patient after a discharge has been done or after he or she has been recovered from any illness. Now, you need to complete this task in 180 to 200 words, which means that any extra words which you put in will not be counted for your grades. Which means that even if you are putting, say you have 220 words in your letter, this is excluding the format. Now, if you have 220 letters, the letters from 201 to 220 will not be counted. Even if you have important information stored, written in that particular paragraph. So you need to know where exactly to stop and to put in the right information and to remove the irrelevant information. Now, speaking again has two tasks. It's basically a role play. You take in the role of a nurse if you are taking the nurse's exam. So what happens here is you are taking the role of a nurse, and you will be speaking to a patient who has come for a particular purpose, which could be either following up of his or her kid, or it could be a consultation or an advice. So you will need to ask questions, reassure the patient, and also give advice, what is the future advice that is required. So you need to, unlike the IELTS, you need to be dominant, but here you can't be dominant. You have to, because you're dealing with patients who can be irate or angry. They can be on medication, so they may not answer your questions. So you're looking at somewhat submissive kind of speaking. You cannot dominate here. So you need to be very submissive. Unlike in India, you cannot. You're not supposed to be rude to patients. They might file a case against you, against the hospital. So it's a different ballgame there. Now there will be an interlocutor who will be at the other side, take the role of the other person or the patient. So what happens here is the interlocutor is the person who you will be talking to, but in the IELTS, the person you are talking to will judge you. But here, it is not the interlocutor who will be judging you or marking your grades. This will be recorded and sent to a third person, which will have no knowledge about your scores in other modules. So which means that this is good news. Nobody can manipulate the system, so it's foolproof. Now here, this is basically, you will be given a warm-up session for a few minutes, wherein you will be asked about your profession, your name, etc. and then you'll be given a small card. You'll be having a card. The interlocutor will be having a card, and what you're supposed to speak and do will be in your card. And based on that card, you ask questions and reassure the patient. For instance, maybe the patient is too sick, so you need to give advice as to improve the nutrition, take medications, relax, and so on and so forth. So it's totally different from IELTS. So people who are tuned to IELTS need to use a different strategy here to gain at least a good grade, which is B. Now here are the grading methods here. There's no pass or fail here for OET. It's A to E. We are looking at B here. B is equivalent to IELTS 7. But again, some professional bodies can relax it depending on the requirement, the requirement in the job sector. If there's a high level of demand, then they are likely to reduce the grades, which can go up to C, which is easy to obtain. This is the C grade. The C grade is not acceptable in most medical councils. You require at least B in all 4 modules. So you need to get at least B. And one positive sign is that you are allowed to take modules separately here. In the IELTS, you have to take the whole test, the 4 modules in one shot. Here, you are free to take, say, you want only the speaking to be taken, you can do that. But again, your professional body will decide whether that is valid for you. Because some professional bodies require you to clear the test in one shot. But however, if you have a slight dip in your grade, you can always go ahead and rewrite it and obtain a B grade. So that's left for you to negotiate with the employer depending on how good you are. So these are the grades. Now let's just compare it with IELTS versus OET. As you can see here, in IELTS you have 3 tasks. In OET reading you have just 2 tasks. So this is the duration, and this is on any topic. In IELTS you are confronted with any topic, and it can be computers, geography, history, politics, anything. But here it is medical specific, related to your profession, one of the 12 professions. Now to get a 7 grade you need to have 80% here, but in OET you require just 65% marks to get a B grade, which is equivalent to 7 in IELTS. So that is good news here. There's a vast difference. There's almost a 15% difference, which makes it easier for you to get a grade B. And as far as listening is concerned, it's mainly notes taking. And this is a medical topic which you're familiar with. Unlike here in IELTS, where you are bombarded with anything under the sun. So here also you need 80% to get a 7 band in IELTS, whereas here you require just 50% to get a B grade, which is a 7 equivalent in IELTS. Now writing in IELTS can be any topic, but here it is basically health related. And as you can see, the medical referral letter is a format which is easy to grasp. It's basically either to a social worker, a care home, a district nurse, or a physician. So you will need to know exactly where to stop and to contain your 180 to 200 words. And speaking has 3 parts in IELTS, which is the intro. Then you need to talk on a topic, and then you have a discussion based on this topic, which is again testing your skills. So you need to dominate here, as I mentioned before. But here again you take the role of a nurse, and you need to reassure the patient and fulfill your task as per the role play card that you are given before the speaking test. And this again is a medical topic. So one good thing for healthcare professionals is that OET is the best option compared to IELTS, but again it depends on whether you intend to go as a student, a migrant, or a healthcare provider, professional. So it depends again. And just a little difference between the UK and US spellings. We are basically looking at the UK market for nurses and other healthcare professionals. So if you look at the UK, I forgot to introduce myself because I just kept on this. I started with the US provider somewhere in 2000. So I used to be a quality analyst for a US provider. That was the year 2000. So then after 5 years I shifted to the UK when the UK market picked up. So I've been associated with the NHS as a proofreader and a quality analyst. A quality analyst basically reviews medical documents before it goes to the hospital server or to the doctor's table. Now, unlike in India, every patient-doctor relationship or the meeting has to be recorded and documented. For instance, you have to document all the medications, the treatment offered, and also the number of visits, the diagnosis, the prognosis, and so on. And this has to actually be stored in the hospital server in case there is a dispute between the patient and the doctor, because medical negligence is a huge business in developed countries like Canada or US, UK. So it's very important for the courts to come to a conclusion. So a quality analyst actually looks at the accuracy of these documents in terms of the English content, the medications, the usage, that it complies with the NHS rules if it is in the UK, and the American standards if it is in US. Now, you find that there's a difference in the spellings in UK and US. In Britain, we are tuned to use the word color as with a U. Now, in US, they do not use the word O for color, and as you can see, this is a difference here. There's a difference. These are RE, it's an ER. Organized again is with a C, which is an Z. They pronounce it as C in US. Behavior again, these are just a few. Here again, they have the tendency to use Z instead of S. So if you look at this, these are English words. These are a couple of English words out of the hundred and thousands of words. Now, if you look at the medical words, also there is a difference. Sorry, there is a difference in the spelling here. You can see an A, additional A here, A here. Etiology is again with an A. This is the edema, which means swelling. So you have an OE here. And these are just a few difference between the US and the UK spelling. The problem is we tend to use computers, so we are actually given the right suggestions through computers. So we tend to use both British as well as English spellings in OET. So you need to keep this in mind. So you need to be consistent in your writing, which means that you will need to stick to the UK standards and not the US standards, because that can be inconsistency with regard to your with your writing. Now, there's also a difference in medications, because the trade names that are used in the US is totally different from those used in UK. And let's look at the medical abbreviations here. Medical abbreviations is what you can see on the top is CV, which means curriculum vitae, which is a Latin word. Now, CV also stands for cardiovascular, costovertebral, and so on and so forth.